On the day of your appointment, you'll come in and get nice and numb. Once you're numb, relaxed, Dr. Conner will place this clamp on your tooth. The clamp has a metal bar that holds this rubber dam in place. It's important to remember not to bite your teeth together once this clamp has been placed, because you run the risk of fracturing or breaking your opposing teeth. So, to help you remember that and to relax the jaw muscles, we place this prop on the opposite side. Just kind of helps you relax. You don't have to stay awake if you don't want to. You don't have to worry about biting your teeth together. So, what the clamp does is hold our rubber dam in place. The rubber dam covers your entire mouth, so you need to be able to breathe through your nose clearly on the day of your appointment. It also isolates the tooth from the 300 species of bacteria in your mouth. We also use irrigant materials that are great for disinfecting your tooth, but not so much for the rest of your mouth. So it's kind of a win-win. So, once your rubber dam's in place and you have your prop, Dr. Conner will start by making a small access hole through the top of your tooth. From there, she's able to see down into the canals of your tooth. She'll then locate the different canals, anywhere from 1 to 4, sometimes many 5 canals. She'll remove any nerve or tissue she finds. From that point, you can go either 2 ways. If your tooth is alive, it's a vital tooth, has a blood supply, means that the bacteria has not been exposed to your tooth for a long period of time, has not had a chance to leach into the walls of your root. So from that point, she'll instrument, disinfect and fill the tooth in one day. Now, if your tooth has been necrotic, meaning that bacteria has sat in the tooth long enough to kill off this nerve and the blood supply, it's also had enough time to leach into the tiny pores of the root. From that point, she'll choose to place a medicine called calcium hydroxide. That will sit in your canal for 3 to 4 weeks. From that point, we'll bring you back in, get you numb, and place. I'm working in this environment, just too noisy. Alright, so once she's placed the calcium hydroxide, she'll seal the tooth with the temporary filling and we'll send you on your way. Now, that'll stay inside your tooth for a period of 3 to 4 weeks, all the time killing off any bacteria that remains in the root of your tooth. Once that period is over, we'll bring you back in, we'll get you numb again, place the rubber dam and the clamp, get you nice and comfortable, and re-access the tooth. From there, we're looking for a few things. One, if the tooth is asymptomatic, you've got no problems with the tooth. 2, no bacterial odor, no pus. Stop laughing at me, Colleen. No bacteria, no pus. From there, we can remove the medicine, re-disinfect the tooth, instrument all the way down to the apex of the tooth, and fill. From there, we'll place a temporary filling and send you to your dentist for permanent restoration. Root canals tend to get a bad name or bad rap. We want you to be numb and bored. It's basically like having a really long filling. You get numb, we place the rubber dam, the clamp, the prop so you can rest your teeth together. We have you put on some sunglasses, turn on some music, and pretty much lay still for about an hour. That's the hardest part of a root canal. There should be no pain involved once you're nice and numb.
Yes.